Hello, I'm Rick Steiner with Steiner Event Group. Welcome to another episode of Luxe Life Discovered. My co-host is Shannon Richmond with the Panama City Beach Chamber of Commerce. So Shannon, glad to have you.
Glad to have me back too.
I know, it's always good to be here. And then our guest is another returnee, and this is Dr. Robert Howard, and we're glad to have you with us again today.
Great to be here.
It's glad to have you in person. We did the remote the first time, so it's good to have you actually in studio with us. So. We had a great conversation with you before, and a lot of things we touched on a lot of things regarding men's health, but let's talk about the mental aspect of the men's health issues today.
Okay.
Let's begin there.
Okay,
Yeah.
sure. So, well, thanks for having me on. I think I'm passionate about men's health, and men's mental health is especially an area that's really overlooked in the healthcare system. If you look at the statistics of just being male, they're really quite poor. And men die much more, die younger than women. In average life expectancy about 73.5 for men. But if you also look at all-cause mortality, men die at a much higher rate than women. When it comes to mental health, you see a lot of issues there as far as access to care, and also men really not being able to speak up to seek the mental health care that they need.
Right. So kind of give us a little bit more background into your mental health work, because you deal with the VA, and so kind of share with us about that.
Okay. I've been with the VA for 10 years now. I love working with our vets. My passion for working with our veterans, I think, really stemmed from my time in medical school when we did our early rotations, rotating at the different hospitals. And I love working with our vets. I clearly remember on rounds going in, and back then they would have 4 patients in a hospital room,
Right.
and they would all be up on the at the bottom of their beds talking about war stories and so forth. And it was just so cool, and just such an awesome opportunity to try to give just a fraction back to what our veterans have done for our country. So I love that. I'm a civilian. I'm not military myself, but I grew up with both my grandfathers being World War II heroes, and I grew up adoring them. So that, I think, just really ingrained in me a sense of passion for helping our vets.
Well, and when you were hearing those stories from the vets, I mean, they were saying, I'm sure they were saying that with just as passionate as they were if they were on the front line, because my father was a vet, and he wouldn't talk about things for years. So, it was amazing what he kept inside, and then as he got older, different things would come out. And then when he went to the VA for different appointments and stuff, somebody would talk to him about something, and that would kind of jog a, memory or whatever. So, yeah.
It's interesting you mentioned that, because I think a lot of men are very private with that. And, my grandparents, both my grandfathers didn't really speak much of World War II either. It was kind of something you knew that they had gone through, and it really didn't pique my curiosity until I was older and wanted to know more about their experiences there.
Right.
So, I think there's something about that when you've been through something, and I'm speaking, mainly to combat veterans, I think in this situation, or people that have been in really tough situations, it's hard for the average person to relate to that.
Right.
And I think they really enjoy talking to each other. They have a kindred spirit there, and so they really find support, in their peers.
Oh yeah, and think about the ages they were when they were thrown into the front line.
Okay.
To something you can prepare for part of it, but there's, I'm sure, a lot of that no preparation would ever have you ready for, like, battle, that type thing. So as far as like the psychological and the mental aspect of it, and
There's certainly common themes. So often the veterans that I work with, whether they've been, by the time they're coming to mental health, often it's for PTSD, depression, bipolar disorder, or substance use being the most common conditions. But there are common themes that you see really with each war generation. And for one, veterans love to support other veterans, and they really see them as their peers, and they trust them probably more so than their providers. And I think there's a lot of different veteran support groups that are out there, and you'll see that veterans helping veterans is often the best medicine. But I would say some common themes that I see with guys coming back from, I would say particularly transitioning out of the military, coming into the VA, is a hard time adjusting And if you think about it, when you're in the military, you have a set job, you have a guaranteed income, right? You have expectations that are placed upon
True,
you.
yeah.
And if you don't do that, you're kicked out of the military. So I think a lot of veterans really struggle with adopting to civilian life when they get out of the military and when they come into that's about the time they come into the VA system as well.
Yeah.
So I think helping veterans with that sense of adjustment. And if you think about if you're a combat veteran and you're kicking in doors for a living and blowing stuff up and shooting things down, really hard to sit at a desk job
Well, that's true.
and,
Yeah.
and
Yeah.
adapt to the civilian world. So I think that's why they're really drawn to other veteran groups as part of their support system.
Well, that makes sense because, I mean, you've gone from seeing the worst and being in situations that you can't prepare for, and then all of a sudden you're back to like a 9 to 5, and I can't even imagine. So
I can't either. And you hear just stories of heroism that are just incredible with some of these guys and capable of so much. And it's really interesting that a lot of them can come back and have a difficult time doing things that
right,
would seem really mundane to us.
and
kind of
the what they did before in some cases.
but
Yeah.
it's so much of their training is to be prepared and be alert and to respond, and it's pretty exciting stuff for
Yeah.
a lot of them. And then to come
That's-
back to civilian life is, I think, a real challenge for them.
Right.
And so the VA has done a much better job about helping our military get transitioned into the VA system, but I think we still have some work there to do. And I think if guys have a difficult time really adopting to civilian life, that's where you can really see a lot of depression. And I think a lot of guys lose their sense of purpose in life.
Right. Right.
And it can sort of be a downward, kind of a downward spiral for a lot of those guys if they don't get the help that they need.
That's true. Well, with men, it's not just the mental health, but men's health overall. It's there are so many things expected. Sometimes things don't always go as planned, and even like the way we work sometime or our equipment works. Let's just dive into that because
Okay.
you're great about being very straightforward. And so, what's a major issue that men face
Sure.
that they really talk about?
Well, I think looking at men's sexual health, as far as sexual dysfunction goes, erectile dysfunction, are really important topics that are often overlooked. If you think about it, how many times is this something that your doctor really asks you about? But if you think about it, erectile dysfunction or sexual dysfunction can have a tremendous toll on one's personal life, on their relationships, as well as their self-esteem, and I'd say their overall well-being too. So kind of interestingly, a lot of people think erectile dysfunction is something that only affects old men, right? But it's actually really common in younger men too. And it's something like 52% of all men will experience erectile dysfunction at some point in their lives.
Okay.
And if you look at age 40, around age 40, it's about 40%. You get to age 70, it's about 70%. So it's really pretty common. And then if you group in sexual dysfunction as well, which includes difficulty with interest in sex, like low libido, or difficulty with other aspects of it, such as premature ejaculation or anorgasmia, which is inability to achieve orgasm, you're dealing with a much wider range of people.
And it's not just older people.
It's not just older people, yeah.
And it's like even with the testosterone treatment, everybody assumes it's just older people, a certain group, but there's some 20 and 30-year-olds that have very low, right?
Right.
Yeah.
We've definitely, we've treated men in their 20s, and a lot of people think, when it comes to erectile dysfunction, they think, well, it can't be that much to it. It's something that just kind of goes up and down whenever it wants to, right? But there's really a lot involved as far as a man having an erection, right? So you actually have to have, your hormones have to be in check. Involves the brain, circulatory system, muscles, the sense of emotion too, right? This element of being attracted. So if you have difficulty in one of those areas, a man can find themselves experiencing erectile dysfunction.
So they're not going to just come in and say, "This is my problem," are they?
Often not. Often not. So I like to ask about it
Okay.
up front, and because
So you just put it out there.
I put it out there.
Okay.
Are they
So-
pretty open with you initially when you do that?
Not always.
Yeah,
Not
okay.
always.
I
Often,
can see that.
Yeah.
often get a call back, hey,
Yeah.
doc, can I have some of those blue bombers? So, I think it's something that unfortunately a lot of men are embarrassed to
Yeah.
speak up about. And, there's so much that it goes on as far as, sexual health goes. And people don't realize that ED can also be caused by common medical conditions, such as high blood pressure, diabetes, peripheral vascular disease, low testosterone. So people don't realize that, it could be a problem in those areas. And also common medications, such as antidepressants are notorious for that.
We'll make a counterbalance.
Counterbalance
Yeah.
that can cause
Okay.
sexual dysfunction. A lot of blood pressure medications. Blood pressure meds are very commonly prescribed. So a lot of people don't realize that, it could be something, they think it's something wrong personally with them.
But it could
It
be
could
a
be other
factor.
factors.
Yeah.
And, psychological makeup, I mean, that's a big part. If you think about, if someone's experiencing stress in their relationships, whether, family stress, depression, social pressures, work pressure, or even trauma, say, for
Right.
example, psychological trauma, can seriously affect someone's ability to have erections.
So the blue bombers, as you
Uh-huh.
call them, can people men take those all the time and it won't hurt them?
So they're generally safe. So,
Okay.
good thing about Viagra and Cialis, everyone has seen the commercials, right?
Yeah.
So everyone knows if
4
you have an
hours.
unstable heart condition, you should be taking them.
Okay.
And everyone knows that erections more than 4 hours are abnormal, unless you're on spring break.
Right.
Did you say
So-
admirable or?
or
No,
abnormal.
I'm just kidding.
So,
So
the
they
good
can't
thing,
hurt themselves if they took one every day.
well, I don't see it taken every day usually. Cialis, for example,
Because it doesn't work
has
immediately.
it works pretty quickly.
So you don't need to take it unless you need to take it.
Yes, so you
Okay.
use, I will, with the exception of, I'll say, Cialis has a longer half-life than Viagra, so we kind of jokingly call it the weekend pill. So guys can take one on Friday, and you're good to
Okay.
go all weekend. Viagra, for example, is shorter acting, so that, take one on Friday, you might just get the benefit Friday night.
Yeah.
So it's shorter acting in nature. So, and there are other things that we can look at as far as treatment goes. There's a really interesting peptide out there called PT-141, which has been shown to improve sexual pleasure and sexual desire. That is something that can be used for females too.
Oh.
And,
What is it? A pill?
It's actually it's a peptide. It's actually a small injection that you can take. So we also other treatments. And I would say in very severe cases, like someone with spinal cord injury, they can use alprostadil or Trimix solution, which provides instantaneous erection. So those really reserved for people
Right.
that really have
serious
anatomical
need, yeah.
reasons for not being able to achieve an erection.
Could you imagine? That'd be like going to your doctor, telling them something's wrong, but not telling them really what's wrong.
Mm-hmm.
And then you
Well, I'm
just,
sure there are a
you
lot of
just come
people
out
that
and
do that.
ask
I,
them.
I like to ask about it, and I tell people, here's how we commonly treat it, and here are the options. And I often, guys kind of snicker when you bring this up, but the questions that I often have for people are, okay, number one, is it as good as it used to be? And number two, could it be better? So if you answer yes to one of those, you could probably stand to benefit in some way.
And it also, I'm sure, goes to that trust level as you build that trust with them, because guys just keep everything in typically. So
And then we were
interesting.
talking about testosterone can be for men or women.
Men or women. So testosterone is really great for improving libido. So you see that both in men and women, and it can also help with erections too. But it's generally not seen as a treatment for erectile dysfunction, but certainly can have the benefits there too.
Okay, good.
So most guys that take testosterone, they're usually really excited about that aspect of it.
Right.
So if we were to come to you, you would do a complete panel workup.
Mm-hmm.
And then besides just that panel workup, after you read it, you're going to actually have a sit down with us and figure out what we're going through, what we're feeling, because this may say something different than this says.
The lap work.
Right?
Yeah.
Oh, yeah. This is
Yeah.
my lab.
I know. I knew what you were doing
Okay,
with
so
the
the
lap.
lab work
Yeah.
may say something totally different than what I'm experiencing and telling you. So it could be something psychological. It could be just a million things, but you put those two pieces together and then get a plan.
So we really tried to come up with a plan that's custom curated to each patient that
Not
comes
cookie
in.
cutter,
It's
you
not
get
cookie
this,
cutter.
okay.
So you'll see some of these TRT programs out there, and there's some of these online platforms that just say, send us some blood work in, we send you testosterone, for example. One of the things we really love about our company with Optimize is we're all about the relationship with our patients. And we want people to have a good experience and make sure that we're treating the whole person
Right.
and not just a set of lab values.
I like that.
And then there's follow up. Usually, I mean, after like 3 months, is that they do follow up lab
Follow
work?
up. So we usually like for people to have labs 2 to 3 months after
Okay,
their initial
yeah.
lab work to see where they are after they start treatment. You can have, depending on what's going on, we may request that you have lab work more frequently
Right,
throughout the year.
right.
But generally, in general, usually every 6 months.
But if you're not asked to provide the lab work initially, or to even have a follow up, then you really need to find another group to work with.
I would
Don't
think
you
so.
think? Because
So-
I mean, to me, that would be the most important. That's how you gauge
You got to read
what's
you
working.
inside outside.
Yeah, yeah.
There are a lot of companies out there that are doing this, and again, what I think really sets us apart is the relationships, and also think, in looking at these programs, I think people should be thinking is this a provider that really has an interest in my health? Is this something that they're just doing to make money, or this is someone that really cares about me?
Right.
And so, this is someone that's really looking at my labs and following up with me.
True.
And
yeah.
so that's one of the things that we do and really take pride in.
Yeah,
Well,
I
good.
think if you didn't build that relationship, some men may not want to go in. They're too embarrassed. They just want to fill out that thing online and get something sent to them. So building that relationship is really important for that patient. And I bet you they feel that when they sit there and have a conversation with you.
Well, thanks. So I hope so. Interestingly, there's been a real explosion in telehealth companies. I don't know if you know much about these out there. They're really under a lot of scrutiny right now as when it comes to prescribing controlled substances, and testosterone is one of those. It's not one that
That's a
know
controlled
has
substance?
It is, yes. So it's so the DEA has different medications on a schedule, and so that is a controlled substance. So they're just different things that we have to be careful about there. But with all these telehealth companies that are coming on board that have just tried to, without any sort of sit down one-on-one encounter with a patient, they'll send these medications out to you. That's
So they're
coming
doing-
to an end.
They're doing
So-
it without lab work, even.
Oh, they will do it. They generally have to have lab work.
Okay,
And they should
good,
have
good.
at least a video connection with you.
Right.
A video evaluation. So, what it looks like it's going to happen here in the next few weeks. So the COVID pandemic, restrictions are, let me back up. The COVID emergency order is going to be lifted. So everyone's going to have to go back to a face-to-face appointment for
I guess
controlled substances.
because of COVID,
With
that
some,
did open up a door for a lot of
exceptions.
yeah, yeah. Wow, I hadn't thought about that, but yeah, I know they do telehealth for other medical areas, but I didn't think about this area, and then how it could be abused at the same time. So that's interesting.
So are a lot of the things that you do, are they covered by insurance?
So we don't take insurance. So with Optimize You, we have a subscription service.
Okay.
So what we have found out is we try to offer people an affordable rate
Okay.
and a plan that makes sense for them.
Yeah.
So
Got to invest in
a
yourself.
problem with a lot of the insurance companies is they don't want to pay necessarily for things like this. So for one, they would be covering millions of men that would need testosterone that would qualify for treatment that
Right.
currently don't qualify. And if you look at the lab values on testosterone levels, there's a really broad range. So somewhere between 200 and 900. So if you fall somewhere in the middle of there, the insurance companies will
say,
say,
"Oh,
"Oh,
you're
you're fine,"
yeah.
right?
Yeah.
Even if you're having all of these symptoms, so you might be, pretty low to the bottom, but the insurance companies will say, "Well,
You're still in that number.
you're still in that number,
Yeah.
so we're not going to treat you."
Wow.
So we work around that and really try to put the focus back on the patient, and we eliminate the insurance
I
companies.
think that's way better because then you get to focus on that person as a person, not, oh, your benefits are this. This is all you get. Don't put me in that little box. Get that plan and be able to work with it. Like a lot of chiropractors do that too. Give you a plan and then you work with that and forget your insurance. You're getting treated for what you need to have. So that's kind of that's an awesome plan.
But we like putting the patient back in the driver's seat there,
I like
and
that.
letting them choose what plan they want to do.
Yeah.
And It also gives them greater flexibility without the insurance company saying, "Oh, you can or can't have this."
Oh,
And
yeah.
you know, look at weight loss options, for example. They don't like to pay for that. We know that that significantly reduces your chances for
True. All
diabetes,
these,
heart
yeah.
disease,
Yeah.
strokes, and everything else. So we try to put the focus back on the patient.
So it's a concierge service.
Concierge
Yeah.
I
service,
love
yes.
that.
Yeah.
So people pay a monthly fee, and with that includes their lab work, that includes any additional consultations they need with us. We don't make people come in unnecessarily, and some clinics will do that just for billing purposes.
Just to get that. You
Just to
came
get,
in and there's your copay.
yes,
Right.
Yep.
yep.
Okay.
So we don't make people come in necessarily. Now people do. We still need to be checking in with them, of course.
Right.
But we give people a lot of freedom and flexibility too, and they always kind of know they can come in and see us whenever they need to.
That's good. So now you have branches, several branches already, and you're still expanding. So where all do you have your branches now?
So of course Murray.
Right.
We're opening Owensboro, Kentucky here April 10th. So we're really excited
Okay.
about that. We're looking at Evansville. Hopefully that will be later this summer, and hopefully many other
And
places.
you have Nashville.
With,
Is that-
we have 2 locations in
Okay,
Nashville,
all right, yeah.
Nashville and Franklin. We have roughly 15 clinics across the country.
And that's amazing. Yeah.
So
Hopefully here soon.
hopefully here.
Yes, I think it'd be a very good asset to the area here for sure. Well, so the Optimize You part of it, you've got such a strong medical background already. How did this come into play? Like, did you know what I'm saying? It's like you already had a great practice established.
Mhm.
You just need something else to do?
This is a great question. I can explain this in 2 ways. So, a lot of my work in my private practice has been with addiction treatment. So, one of the things that I found over the years, especially with working with opioid use disorders, people addicted to narcotic pain medicine, is quite interestingly, I would have them in recovery for a period of a year or so. And these men, often young men, were coming back and reporting symptoms of low T, such as saying, you know, and my sex drive isn't there, I'm gaining weight, you know, my sleep is terrible, I'm in recovery, why am I not feeling great?
Right.
But
Yeah.
they should be feeling great. And quite interestingly, if you look, when we did their lab tests, they're all low in their testosterone levels. And these would be really young men, up in their 24 or so, with, you know,
Wow.
just really low levels. And what we know is that substance use disorders wreak havoc on your natural hormone production. So
Okay.
even though this person was in recovery, you know, long-standing substance abuse really wrecked their hormone production.
Never thought about
So
that. Yeah.
I got into it initially that way, and helping people get you know, back on testosterone. They come back and they're like, "Oh, I feel great." You know,
Yeah.
you know, energy's great, their mood's great,
And
it
that
was
helps with the other
and
part
that,
of
and that helps
healing.
with
Yeah.
you know, sustain the recovery
Yeah.
as well.
Exactly.
And which is often why a lot of people relapse, because they're not feeling good,
Sure,
right? And they're
yeah.
just looking to feel better. So it's been a great way to help sustain the recovery. So that was really fascinating, and I loved that. And I loved how men would come back and just say how great they felt on testosterone, and how they didn't realize that was something that they needed.
Yeah.
And it was really kind of surprising to them. So, and I kind of jokingly say it makes everything better, right? As far as your moods go, erections, sex drive, even your skin. I mean, it just improves everything. So I got into it that way. You know, I've also had my own personal journey with being on testosterone replacement, and I'm open about that. In my late 30s, I noticed I wasn't having the energy that I used to have. You know, little kids were coming along in the family, and it was a lot to keep up with. And sleep certainly wasn't very good. But also I was gaining weight, and I really didn't like how I was feeling. And I wasn't
Right.
really liking how I was looking. And I didn't like the path that I was on. So I got my hormone levels tested, and I got started on testosterone therapy. And it's been life-changing for me. And I'm here to tell the world about it because it's awesome stuff.
That's awesome.
It is, and that's an area that most guys would never think that could be an issue. You know, so it's, you know, we talk about it, so to us it makes sense. But there are so many people that would never think, oh, it could be my testosterone, you know, that type thing. So
Or maybe they just don't think they can feel any better.
yeah,
Maybe
Or they think
this is all
or they
can
think that
get.
they're still young. It
True,
can be,
yeah.
it can be low testosterone, right?
Right, because
Oh,
I'm
and
too
another
young for
thing,
that. Yeah, that's
some
old
guys are
people.
just too
Yeah,
macho for it. They're
yeah.
like, oh, it can't be my testosterone. My
Right,
testosterone has to
right.
be through the
I'm
roof.
good.
Oh,
Yeah.
So you've got that barrier too.
True,
Yeah.
true. So, do you have any clients or patients that come in and that's the issue that are still like, I can't be it? You know what I'm saying? That's like not denial, but
denial.
yeah,
I think so. But it's kind of funny because I'll show them what their levels are, and it's almost like they're offended.
right.
And,
Yeah,
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 it's like it
You
can't
embarrass
be
them.
that
right.
low. It's just like
Exactly.
it's
Yeah.
like I'm not trying to make you feel less of a man. I'm just like
It's not
here.
me.
This is
Yeah.
just this is factual data that your levels are in fact low.
Yeah.
So do with that information what you want, but
True.
often people can't believe how low they are.
Yeah.
So
Well, I think that's been amazing too. And then to know that some 20-year-olds have such a low level, and you would never think that, or you just don't think about that at that age.
And who would think about just because you took one or two medications that's going to happen?
mm-hmm.
Because you have to have those medications,
Yeah.
and then that happens. So it's just good to get it all out there. This is what I'm doing. Help me.
All right.
Then
Let
you
me
can
ask.
read it.
Mm-hmm.
I said too. So if it is a medication they're taking that's causing that, how?
Talk about the ED or low
Yeah,
testosterone.
either one. Yeah. How do you deal with that? Because are they able to take the other? I mean, take the shots or whatever's necessary. Is that going to?
Kind of depends on what's going on. So occasionally we'll have someone that comes in with a history of anabolic steroid abuse, and often these are people that took high doses of steroids when they were younger, for bodybuilding purposes, and not realizing that they've drastically impacted their natural testosterone levels and end
Wow.
up having low levels. Some of those guys can have such low levels that they struggle with infertility as well. And we don't see a lot of that, but we do see some of that. So and with that, they, of course, can have the sexual dysfunction that goes along with that. Now, you're asked about other medications. Are you talking about like blood pressure
Yeah,
medicines?
you're saying blood pressure,
so
diabetes.
diabetes. So you want to make sure that those other factors are in check. So make sure the blood pressure is in check. People still need their blood pressure medicine, right?
Right.
Diabetes, you do everything you can to get their
Blood sugar
sugar
down.
under control,
Yeah.
A1C at a good level. So you want to make sure those parameters are well established with the patient. But also we can look at maybe different medications that don't cause those side effects. So there are other blood pressure options. There are other antidepressants that don't have the sexual side effects that many of them do. But I'm usually upfront with patients that this is something that can happen, and often people often say that I've got to have my antidepressant. I'm not going to take you off of that if it's something you really need.
Sure.
And so we can often add something like Cialis or Viagra to that quite safely, and that helps them with the issue there.
Okay. Man, there's so many different topics we could go to on this and so much we could cover, but we'll save some of that for next time. So thank you again for being with us today.
Thank you. It's a lot of fun.
We appreciate you joining us today on Luxe Life Discovered, and we will see you on our next podcast.
Thanks for having me.
Check out Luxe Life Discovered on Facebook and Instagram and on 30a.tv. See you next time on Luxe Life Discovered.